Welcome to Mindset Mondays. This is Dr. Debra Dupree with Felicia Amenta, and we're here today to do our monthly Q&A. So welcome, Felicia. It's nice to have you here again today.
Wonderful. I'm happy to be here. It's my pleasure.
Great. Well, I know a lot of people have been sort of waiting for this to happen, because we are going to be talking about what's happening in the world of COVID-19 as schools reopen. Are there spikes in cases that are happening? And just what are some general guidelines and trends that maybe the rest of California and perhaps even the country can learn, because San Diego is in the red, which means we can reopen, right?
Yes, we were very happy that we were able to stay red, just able to stay red and stay out of the purple tier, which meant that a lot of our schools could continue. As a trend, I would say, starting 3 weeks ago, some of our charters and our elementary schools opened first, and then we had some of our larger elementary and schools open after that, and then we have some more of our schools opening today and next week, and in the coming weeks. We've had lots of questions about what to do if there's a positive COVID case. Surprisingly, when we talk about trends, we have not had a lot of positive COVID work comp claims filed. We have had, throughout our 66 members in our population, which is about probably 36,000 lives throughout the county, we have had 2 workers' comp claims filed, but neither one of them were accepted. They either didn't test positive or they didn't meet the causation requirements. And so those claims, so we don't have any accepted COVID claims currently. We do have people that have tested positive throughout the county. They just have not filed workers' comp. That's kind of the trend that we're seeing. That will probably change as more and more of our schools reopen, but there's been lots of questions about telecommuting, questions about requests for accommodation, questions about fit testing and the respiratory requirements for N95 masks, if you're going to have some employees wearing those, primarily healthcare workers and special ed employees. And then with the governor's 2 laws that were just passed on September 17th, it's been a challenging time, I'll say, for our member schools.
Well, I can certainly attest to that, because having talked to you frequently and also doing a lot of IPMs in the last couple of weeks, every day was a new day. Well, right now our plan is, and but it has been a moving target the last couple of weeks, because every day the news is changing, the incident rate is changing, and certainly the governor's guidance has changed as well. And so I always like to say, anytime there's uncertainty and unpredictability, it does create a state of anxiousness. And so, I think a lot of us have been anxious, just wondering what next is going to happen. And, but that's very different. I just want to emphasize, anxiousness is very different than a state of anxiety. And so I know a lot of employees, have reported anxiety. And we'll get into that in a little bit as we talk about, dealing with underlying medical conditions with COVID-19 and the interactive process. But for right now, Felicia, I'd like to ask you to maybe highlight, maybe 2 or 3 models of how you see schools reopening, and what is perceived to be the contributor to not having a spike in cases, as we know we saw from San Diego State University.
Well, for the schools have a pretty comprehensive reopening plan that we have to abide by per the state guidelines and the county health department. So our schools have been preparing for some time to try to get ready for the fall reopening. Some of our smaller charter schools have been opening on a hybrid program. Some of the kids are doing distance learning, and some are coming in a few days a week and then working at home a few days a week. Several of the school districts that have opened up are also opening up on a variety of hybrid plans. Some of the most popular being some of the students are attending school 2 to 3 days a week for in-person classrooms to keep class sizes down, and then some students are working at home. And then some of the students are choosing distance learning 5 days a week. And then we've also seen the model where sort of like an A and B track, whereas the A track will come in the morning and then we'll clean in between, and then B track will start in the afternoon. And that has also been another hybrid method that's possible. And then some of our districts have chosen, and charter schools and colleges have chosen to remain primarily in a distance learning mode, kind of in a wait and see position. So each district kind of evaluates, their program and their age range, and decides what they want to do. But we do have quite a few schools opening up for some version of hybrid in-classroom instruction.
Okay. So I know I've certainly been exposed to lots of different models, and so it's been interesting to see what's evolved and and how it will work out. I've been impressed actually with some of the safeguards that I see and hear employers taking, the school districts, in terms of the plexiglass and exchange of materials and all that that's going on, the frequency of sanitization throughout the day, of common areas, limiting numbers of people in restrooms, all those kinds of things where you can come into closer proximity, and so it's pretty phenomenal. I guess, is it too early yet, Felicia, to tell, the results of these different hybrid models in terms of managing infection rates and things like that?
It is. I mean, because the governor's new law, SB 1159, was effective immediately, which usually when there's a new law passed, it takes place in the future. It allows us some time to get ready and pivot. We weren't able to prepare because it became effective on 9/17, and then it retroactively affects us back to July 6th. And so we have to report any and all positive COVID claims from July 6th, and whether they're work related or not, just people that have been at sites that contracted COVID, wherever that may have been contracted at, does not matter as far as the reporting requirement. And so we had to do a rush portal with Athens to get that ready. We have seen some cases reported as of 9/17 going forward. We have 3 business days to report all COVID claims to our claims team. And we have had some COVID claims reported. We just haven't had work comp claims filed. So it is a little bit too early, because that just started last week. It's a little bit too early for me to tell what the infection rate and what the numbers are going to look like.
Yeah. Okay. So a question popped in my head then about that, because you have 3 days to report to Athens and any known claims. What is the time frame, if any, that people might have if they wish to file a workers' comp claim with COVID?
So obviously the COVID claims you want to get it in as soon as possible. We have some people that file the claims when they fear they've been exposed, and they're going to the clinic and they're going to have a test done, but they don't even have a positive test yet. And that is one of the requirements for a COVID claim. You actually do have to have a positive test results. And then there are quite a few triggers. The law, the SB 1159, is pretty complicated. And so I do have a webinar coming up on October 1st at 10 a.m. And we'll be going over all those triggers of how long you have to file a claim.
Okay.
And what are the presumptions that apply, because there are several different presumptions. It's a little bit complicated because we think that our health care professionals and our nurses might be covered under one presumption, and then all of our other employees might be covered under the outbreak presumption. And that is why we have to report to Athens, because that is how we're going to determine if we meet that 4% positivity for an outbreak.
Okay. And so you have this webinar coming up on Thursday, October 1st at 10 a.m., right?
Yes.
Okay, great. And I know this is part of your spring and fall workshop series that you do every year, right?
Yes, but now we're doing them virtually. We really like to bring everybody in person, but we're just not able to do that right now safely.
Yeah. And may I ask who will be speaking?
Yes, Dr. Head, who is the medical director of occupational health for Sharpry-Steely, is going to be starting us out with an update on COVID because things are changing so rapidly. And then Scott Stetler and Joshua Goldsmith will be talking about SB 1159 and AB 685, which both passed. The governors signed them on September 17th. We'll be going into those in detail because those are complex, and the retro reporting, because we only have 30 days from 9/17 to get all of our COVID claims reported from July 6th through 9/17. So,
wow. So that's takes us into what about October 7th, just around the corner. Yeah. Okay. Or 30 days. Oh, no.
30 business days. So it's towards the end of October.
Yeah.
So we have some time.
Okay, great. Well, good. I'm glad to hear that. And so I wanted to let our listeners know then is that we've got some very knowledgeable people speaking on Thursday who it's sort of like from the horse's mouth, right? You know, people who know from both the medical and the legal. So that's going to be very, very much. Is this open to school district members or what?
The JPA members.
Okay,
right.
very good. Okay.
I think it's some other schools have been invited and we're allowing others to attend if they would like.
Okay. Just wanted to make sure again for our listeners then. So what would you say that San Diego County Office of Education has done really well in terms of preparing schools to reopen, and what might other counties in California or even other states learn from us, because we are one of the few states who managed to stay in the red, barely, like you mentioned in the beginning. What do you think has really helped us be there?
I think that obviously when we shut down all of our schools on March 16th, that really helped with containing the virus because we haven't been open, and because a lot of our schools have been really pivoted to distance learning and having all of their employees, for the most part, work from home when and where they can. We do have essential workers that come onto sites, but it's a really low percentage of people that are actually working on site every day. And I do think that the telecommuting agreements, SDCOE had written telecommuting agreements with all of the employees that were working at home to take a picture of their work site to make sure their workspace is ergonomic and safe. Otherwise, loss control can come out and do virtual or Zoom ergonomic evaluations of that space, and a safety checklist of your area. I thought that was a really best practice. And then one of my favorites is the return to work scenarios for managers. It's a conversation guide for return to work that managers can have with their employees, whether they have contracted COVID, whether they have an underlying condition or are concerned about COVID. I think that's a really best practice document because it goes into all of the leaves, the FMLA and the FFCRA and the CARES Act leaves, because these leaves are in addition to the workers' comp, temporary disability, and industrial leave. Someone asked me yesterday if industrial leave can be used by employees that get COVID. And I said, that's a great question, but you need to have a accepted work comp positive COVID claim and TDs being paid by workers' comp for industrial leave to kick in. I think another thing that SDCOE just put out, which is great, is a sample of the respiratory response program that needs to be sent out, and also the requirements like the health questionnaire and the qualitative and quantitative fit testing that has to be done for employees that are going to be required to wear an N95 mask.
Thanks, because I know I've certainly been reading lots and trying to keep up on what's happening out there. And so there's two things I want to emphasize is that one, now more than ever is the time for employers to communicate clearly, about resources and avenues to pursue for employees who have concerns about underlying conditions with COVID. Because right now, people are scared. you know, a lot of uncertainty, a lot of unpredictability, and we just don't know. You know, this is unprecedented times. And so the more we can communicate and show some compassion, you know, the better people will feel, you know, as far as, you know, you got my back kind of thing. And there's already some preliminary studies showing that, you know, employers who take a very proactive role in communicating are actually more successful in retaining their people. Because that's another thing, turnover has been huge for a lot of employment sectors out there outside of the school district. And you know, people are just willing to move on, even though, you know, jobs are tight. And so, again, how an employer responds and showing some compassion is a huge factor in employees wanting to stay. And so that's just something to keep in mind, you know that I want to put out there, because, you know, I know they keep saying this, we're in this together, and sometimes people don't always feel that way. It's easy to say, but not always easy to do and demonstrate.
And I always remind the charter schools and the school districts and the colleges when I talk to them to keep in mind that in the workers' comp program, we're already paying for the EASE, MHN, mental health, no-cost counseling for 6 visits. So we should really be using that all the time for people that have fears and anxiety with as return to work is getting closer, because I'm getting more and more calls as schools are trying to reopen for the fall for in-person instruction, with a lot of anxious questions and requests for accommodations. And I think it's important to always keep that EASE benefit top of mind. I think it's, I always say that it's the least utilized best program in the JPA, and we're already paying for it anyway, and it covers every single employee, because I do feel that I can use, for example, our claims team. We have a dedicated claims team at Athens that handles all of our workers' comp claims, who I think does a marvelous job. But they closed their offices in March, and they all went to home, working at home entirely. And they had to pivot to that very quickly. And I have to say, I just think that their service level has remained really high. Communication level has been excellent. I've been very impressed.
Yeah, I mean, I have to say, you know, in doing many of the interactive process meetings, both for work-related injuries and other medical conditions, and now with the COVID underlying conditions, been very responsive. And one thing I'll say to echo what you mentioned about EASE is that I bring it up in almost every IPM. Sometimes I'll forget, but in almost every IPM. In fact, I just made a note this weekend to include it on my form, so I don't forget to do it. But it's amazing. I mean, I've done hundreds, and I would say probably less than 1% have actually known about EASE. And I know that you put the word out, and you know, it's information readily available, but people just are not aware. And we all can use a little help through difficult transitions, and so it's not something to be afraid to ask for and to engage in. Yeah. I guess I'm wondering, Felicia, from your perspective, you know, what are some of the top questions that you hear, you know, that you receive from some of the school districts around the county?
I would say it has changed somewhat from March. Since we closed on March 16th, and pivoted to working at home. There were a lot of questions at that time about leave and what about people that were off work on modified duty, but there's no duty because there's no work. And so I told them I considered the telecommuting at that time modified duty at its best, right? Because you didn't have any, you know, physical requirements other than what you're working at home might have required. And then that was a question that happened a lot then. The questions have changed over time. I would say the questions that I get right now that are really top of mind is nurses and special ed employees that might be coming in contact with students with COVID who need to wear an N95 mask, who have not been fit tested for those masks, and the school district has to have a written respiratory response plan with people that are responsible for storing those masks safely and providing those masks safely. That is a whole entire responsibility at each site. And so there's been a lot of questions about our contracts that we have done with Concentra and with Palomar Health and Work Partners, both for the health questionnaires and fit testing. And they will come on site to do that for an extra fee. And about the pricing about that, I get a lot of questions about that. I get a lot of questions about employees who are afraid to return to work or who have underlying medical issues and feel that they cannot return to work, or have family members at home that they're concerned about and feel that they can't return to work, or have a real important one, daycare and childcare issues with employees who have children who are in school districts where they're distance learning only, and they have challenges with coming in and reporting back to work. One of the models that I didn't mention was I do have some districts that are in distance learning, but all teachers are required to come into the district and teach from the classroom. I forgot to mention that. That is, I would say that's a popular option, and quite a few districts are doing that. So there was a lot of questions because they were coming back to work, obviously with masks and sanitization and social distancing, and the kids, the students weren't in the classroom, but the teachers are in the classroom, teaching from the classroom. And I know you have seen that too on some of the districts that you've been doing IPMs on. That's been a popular model, but that raised a lot of questions about I still have significant issues, and could I be allowed to continue, or could I change to a different class where I could do distance learning from my home? Would that be possible? So these are all questions that bring up IPNs, all these questions about return to work. And then a lot of people say, are those work related? You know, and I said, no, those are COVID related, but they're not related to a work comp claim. As we know that if you're doing an interactive process meeting and you're using Dr. Dupree to mediate, if it is an accepted workers' comp claim, yes, it can be paid for on the work comp claim. If it is about non-industrial issues, which I consider all of these things that we've been talking about in the non-industrial world, then that's paid for by the district.
Yeah.
Or by the charter school or by the community college.
Yeah, no, I'm well aware of that model, and it's a great way to get people back to work, you know, and sort of ease people in before we start bringing all the students. And so there've been some very interesting models. I know one district, I've got a few districts, you know, have students coming in on Monday, Tuesday. Wednesday is a staff only kind of day, and you're doing essential things like limited students on campus to do assessments or whatever like that for IEPs, and then another group of students coming in on Thursday and Friday. And so just some of the precautions and sanitization that are going on with that is really, really key. Before we go into more COVID-19 related things, you raised the question about the special mask and who's that applicable for. So I know that I had early on, when schools are starting to return back in August, a question about a middle school teacher who wanted to wear a mask at all times in the classroom, and did quite a bit of research on that. And so from what I had read, it was not something that was encouraged, because she didn't really meet any of the criteria as an essential worker and things like that. Say more about what you mentioned as far as nurses and staffing with students.
So each charter school and school district and community college gets to decide in their respiratory response program who is required to wear an N95 mask. When you think about N95 masks, they're fitted to your face, and you're breathing out of a respirator piece, and that's why you have to be fit tested. Not everybody can wear one. Children cannot wear them because of the size of their face, and they're not for, they're in our world. When we're talking about them, we're talking about employees. And I know we started talking with a district that was preparing their respiratory response program, and they began with, we're going to have 300 of our employees have a health questionnaire and fit tested for N95 masks. And after preparing their respiratory response program and going through all the work, and also this is PPE, so this is healthcare. It's also in limited supply, so we want to be careful about who's wearing them. And after learning everything about them, it was 11. We had 11 staff that were fit tested for N95 masks. It's also expensive, and they have to be fit tested every year, and they're difficult to wear, and it's hard to hear with them, and it's hard to wear them for long periods of time. And there are real reasons to wear them. And if you've been into a Kaiser or a Sharp facility lately, you do not see all healthcare workers wearing N95 masks. It is the employees that are working on COVID wards and COVID floors, and that are working in the ICU that are wearing an N95 mask. So, and because there are OSHA requirements to them that are quite stringent, that's why I think we went from 300 employees wearing N95 masks down to 11.
Yeah.
From that. So you have to kind of, once you delve into it and start looking at who should be wearing them, it becomes quite clear as you go through the process.
Yeah, and so it takes a little bit more detailed or diver deep into assessing and evaluating who really needs one, and again to meet other criteria, because like you said, it's OSHA. It's got you have to have your respiratory practices in place and all that kind of thing. Yeah, and so so that takes me then to I'd like to talk more about underlying conditions with COVID-19. And I know you alerted me early on, what the County Office of Education's approach was going to be as far as recommending utilization of IPMs. And certainly that's become standard practice. Is that, in a way, what better form is there? Because it is confidential, it's limited to those who need to come together to make decisions. And I would say, having done a number of them now, I mean, it really follows much like a regular IPM, because, what is a condition and how does it impact your life, and what kinds of modifications or accommodations can be made. And so what are you hearing from employers out there about these underlying conditions and how to proceed?
So when you think about when I look at the conversation guide that our HR department created at SDCOE, it has 7 different scenarios that could happen. And then it kind of describes, because the leaves are so complicated, it describes when FMLA applies and when FFCRA. We just got a really good question from a district on Friday, because they have an employee that tested positive for COVID, but then there are several employees that worked really closely with that employee that think that they might have COVID, so then there were conversations about that. Who needs to be given a claim form? What I always say is that if the employee feels that their COVID was contracted at work, when in doubt, give them a claim form. We have 24 hours to advise them of their right. Most of the employees are not filing work comp claims. I'm not sure if that's because they don't at the end feel that they got their COVID at work, or if the COVID, they were just quarantined and stayed home and they were covered by other leaves, by the quarantine type leaves, and therefore did not file a comp claim. But I always feel, when in doubt, if anybody's calling me and asking me and obviously these are for employees that have worked at sites, not working at home, cannot file a COVID-19 work-related claim if you have been working at home. And that was another question we've gotten about the retroactive reporting, is what if the employee hasn't been working at a site, and you don't have to report those COVID claims, because really what we're trying to get at is outbreaks and spread, right? So that's what we're trying to determine, who was tested positive for COVID, and how many people do we have working on site each day. And that's been a little challenging. What's the highest number of employees working on site? That's not something we particularly capture. We know on payroll how many people are getting a paycheck at the end of the month, but we don't normally track who's working at our sites every day. Mm-hmm. And that's one of the things that the new law has challenged us with. So.
Very good. What would be some examples of accommodations made? What have you experienced? Because I know I'd like to share a couple of examples for people as far as what we were able to do and what we weren't able to do.
Right. I have seen some really creative items. We have some departments at SDCOE, like outdoor education, where, you know, the kids aren't going to camp right now. And so they have a very specific job and very specific job requirements. And I have seen some real very thoughtful different placements. Like I noticed sometimes when I come in to have my temperature checked, if I need to come on to campus at the Hill, the people that do the symptom questions and the temperature check are some of the people that work in departments where we can't be working with the students right now. And so there's some accommodation that way. I've also seen accommodation where if the teacher was supposed to be coming onto campus, either to teach from the classroom or they're back for some hybrid in-person instruction model, and they have an underlying condition or a family member at home that they feel the risk is too great, they've asked to be placed in another position where they could be working from home. And kind of change their position and modify that way. And sometimes this is for just a certain period of time, and sometimes this is for a longer period of time. So I have seen some really creative accommodations that way. And then, but I have seen some employees where they could not be accommodated. There wasn't any place else to put them. Some of the charter schools and the smaller school districts who don't have a lot of positions available, sometimes leave has been the accommodation. The person is not able to work in the capacity in the way that they're supposed to, and leave has been the way that they've accommodated them.
Yeah, definitely have seen that too. I really, given when, guaranteed wages were, ended at the end of the fiscal year, and then, okay, who's coming back to work? I was just really marveled at some of the repurposing of the employment talent, and how willingly people chipped in order to help get, the schools ready and distributing books and materials and drive-through pickups, and like you say, with the testing and so forth, that really, I would say, very creative and excellent repurposing of talent in very useful ways.
Well, and especially when you think of one of the governor's requirements was that we test all of our employees every 2 months. So, 50% of our employees are tested 1 month, and the county luckily is going to be helping us with that. So 50% of our employees are tested 1 month and 50% are tested the next month. And so like, the NFL, I noticed, is they're testing all of their employees and their staff and all their players every day. We don't have to do that, but I mean, we have a pretty rigorous testing requirements.
Very good. Yeah. Well, I'd like to share, one example recently. It was not a regular classroom teacher, but it was somebody who performed assessments for students who need IEPs. And so, she's been working at home and all that kind of stuff, but now that the school is opened up, she did have a recent medical condition, and another underlying condition. And what we were able to work out is that she would come in on that Wednesday when there were no students, and to perform limited assessments in very sanitized plexiglass kind of environment. And at first she didn't feel she could come back at all. But then it was realized that we went through the job duties and realized that there were about 60% of her job that could be performed distant, but that then she would come in on Wednesdays when there were limited students, only to meet with those who needed assessments. And so we're about a temporary reduction of hours and a temporary reduction of pay. And she actually volunteered the reduction of pay because they're going to have to, use her 2 aides on staff to do more things on campus that she's not then able to do on the other 4 days of the week. And so we've got that going on for 8 weeks. And that will give her more time to recover from one of her conditions. And then she will also get a chance to acclimate and familiarize. We'll also have a chance to monitor any spikes, particularly at her school site. And so that worked out very well. So while she had direct contact with students, not all of her work was direct contact. One where we could not do it, I'll actually shared two. One where we could not do it is the very purpose of the job was to provide childcare. And so, you know, this school site was providing childcare to its staff, teachers, and other administrative support staff, so that they could return to work. But they were also providing it to members of the community, parents of children who were without childcare. And so the very purpose of that job was to provide childcare, and there was no way around it. And that was also an example of where there was an underlying condition, but she was feeling highly anxious about coming back. And so not really a state, you know, a diagnosable state of anxiety, but she was feeling anxious because of this other thing, and that didn't qualify her. And so she was given a leave of absence, and hopefully she'll improve in the next, you know, 30 days or so. And then another one, it was a situation of where there were resource teachers and who normally push into the classroom. They had done some other things behind the scenes, like created a larger centralized work area because the original space was too small and they would have been in direct contact with one another. Well, now they've got a larger space. There's a projects going on where they have to come on to use the resources of the school district itself, but that they're going to allow the resource teachers to come in with predetermined schedules. And so not everybody would be on site at the same time, and they would be given enough time to get their work done. But the other piece of that too was that that particular team had not yet decided how it was going to push into the classrooms under the new conditions. And so I said, well, if you haven't even as a team figured it out, well, I think we can certainly accommodate this one employee who again did have a diagnosable underlying condition. And so it really, you know, just like a regular IPM, it's a case-by-case basis. You know, we've got general guidelines, we've got general considerations, but it really does mean going through things and really see what are the circumstances here? You know, is it you know, a documented medical condition? And then how can we work with the different leaves, the different conditions, the different models in a way that makes sense? And for many, I would encourage people to think about this as being temporary, just like we do temporary job accommodations and other conditions. Because right now we're in a state of flux. We don't know, you know, where, you know, the whole COVID thing, you know, will it truly spike up again the way they're, you know, speculating with colder weather? Or, you know, will we be able to maintain it with all of the protocols and precautions put into place? And then, you know, from what I understand, a lot of school districts said, this is how we're doing it for now. And we'll have to see what 2021 is going to look like. And so well, just like other accommodations then, is that temporary accommodations over the next 60 to 90 days, why not, you know?
And it makes so much sense, right? And that's why our telecommuting agreements only go 90 days out, right? Because they want to reassess at that point, when are they going to bring people in that are maybe on some kind of like in payroll and finance department or like risk management, where people come in on rotating days. So not too many people are in those offices at one time, but those telecommuting agreements are not, you know, just with a never-ending date out. And I do think that a lot of schools do not think or sometimes don't think about a reduction in hours and a reduction in pay is also a reasonable accommodation. We have a work comp claim, very serious amputation case, but the district got so creative. You know, the doctor said that the employee could work 4 hours a day. They said, we've got 2 hours a day of work, and then maybe we could increase that as time goes on if we see how that goes. And he came back 2 hours a day, and he was, you know, the employee was happy to do it. And but that was a question to me: was can we do that? Can we just say, well, we have 2 hours a day, and we can be as flexible as you want to be, because we're self-insured, and we can pay wage loss and workers' comp. We can work around a lot of things, and these are temporary restrictions. So hopefully this continues to improve as the condition improves. So you're right, the COVID-19 accommodations, I think, have even just as much flexibility, if not more, than all of the underlyings. And so I really love all the questions from the school districts on, could we do this, could we do that? Because they're thinking outside the box a little bit. That severely injured employee really wanted to come back to work and has wanted to come back to work ever since his really serious injury. And so they really took a look around, and I think you were involved
Yes, I
in
was.
that one. And I really applaud that kind of thinking. And I think a lot of times people will reach out to me as a resource because I keep everything that I get. So every letter that's gone out from a superintendent or from HR for contact tracing to all the employees that may have been exposed to employee, I keep all the sample letters because some people will say, hey, we'd like a sample letter of what we could send, for our contact tracing, along with the responsibilities to contact the Department of Health to let them know that you have a positive COVID case. I really think that the districts and the community colleges and the charter schools have done an excellent job with how much has been thrown at them. We've had a lot of new leaves and then that they've had to learn. And then that interact with workers' comp and FMLA, which we already had. And then we've had a lot of new safety requirements and not a lot of new risk requirements. And now we have brand new laws that are basically going to change the workers' comp system. The governor's new laws are in effect until 2023. So obviously they think that COVID will be around for a while, right? That gives you an idea of how long they think we're going to be addressing it.
Oh boy.
And we already had an underlying workers' comp law to deal with contagious exposures. And honestly, I've worked with the schools now for 12 years. And during my tenure, we've had lots of contagious diseases like MRSA and impetigo and worms and lice. We get all kinds of exposure to the weirdest things. And the workers' comp system is already developed to deal with this, but I think they wanted additional protections to kind of our earlier conversation. We were talking about liability for schools and whether these things should be covered in workers' comp or whether there should be liability lawsuits. You can see from when you read through SB 1159, that was the intention of that broad law that the legislation passed and the governor signed, was to try to create presumptions so that if they're exposed at work, we're covering those claims and providing workers' comp benefits.
Yeah, it's interesting. As I heard you speak, it reminded me of, I do a monthly podcast also on navigating the interactive process, and have people like you, employment and workers' comp attorneys, speak on different topics, doctors, and we'd been planning the one for March for probably 6 weeks, I guess. And because I had two speakers, Stephen Tissey, employment law, and Mark Barber from workers' comp, and just talking about the interplay of, employment law and workers' comp law. And then COVID-19 hit, and it was like, oh, well, let's rethink this one real quickly, and but both of them emphasized during the podcast that, this isn't our first rodeo. We actually have a lot of protocols, a lot of experiences from the past where we've had to take on new and different things. And certainly this one's probably been a little bit different than maybe some of the ones in the past, but it's real important to say, okay, what can we learn from what's happened in the past, and how might we apply that to what's going on now? And that's where, I was involved in that case you talked about with the amputee. And what was really neat about that is because of COVID-19, his usual shift, which was night, wasn't even operational. And so didn't have a shift to go back to anyway. And all of the night custodians throughout the district were being employed during the day to do that extra sanitization and all that kind of stuff. Things that, it was still part of his job duties, so it wasn't anything different. It was just different to the extent and how they were going about cleaning way beyond what they used to do. And so, it was really a win-win, and thinking outside the box and meeting the needs of everyone concerned. And so I'm really pleased to see that. And we've got a defined period of time too, because we now have some projections about when his condition will be more stabilized. And so I laid out that, we still have to stay within the 180 days max, or 120 days, whatever. And so he's very clear that, if things haven't, gotten better by that time, we may have to go to some additional leave off. But meanwhile, he will have gotten much more improved in contributing in valuable ways to the students, to the community, and to the district.
Yes, it's interesting. I was looking up some case law for a district last Friday,
Mhm.
and I realized that workers' comp came into being in 1917.
Mhm.
So we're quite old now. And in 1918, they did have, that's where we had one of our very first contagious exposure
Mhm.
cases because the Spanish flu came out
Right.
and it was a workers' comp claim. So that's one of the case laws that we refer back to when we're looking at COVID-19, which is so interesting from a historical perspective that we're back here again now. Right.
Almost 100, oh, yeah, 100 years later, right? What
Right.
comes around goes around.
Mhm.
Yeah. So, Felicia, as we wrap up our Q&A session today, you brought together a lot of questions that people have been putting forth, certainly shared some ideas and perspectives. If people had additional questions after hearing this recording or after being part of the program today, what avenues do they have?
They can obviously contact me, and my email is famenta@sdcoe.net, or they can give me a call also, which is fine. We just changed to new Teams phone, so I always have to look up my new number because I had the same number forever. So.
Well, we can put that out in our follow-up. And so for our listeners, I have a number of resources that I have found very interesting. And so we'll be including that in our newsletter to go out tomorrow, which will contain a link to the recording here. And on my website at relationshipsatwork.com, there will be an opportunity for people to put in questions or to provide input in response to the recording. So we'll make that available too. And certainly, Felicia, you and I talk a lot as far as interesting questions that come up, and so which is why we actually started doing this Q&A back in the winter. So, did you want to give your number then?
Yes, I did. My number is 858-295-6972.
Great. Okay. And I'll also share my number here. My number is 619-433-4264. Again, 619-433-4264. Usually best to text me and let me know you want to talk, and then that way I can get back to you more quickly. So I want to say thank you again for joining us on Mindset Mondays Q&A with Felicia Amenta from the JPA manager at San Diego County Office of Education. And we look forward to hearing back from you. Join us again in one more month.
Thank you. It was my pleasure, Deborah.
Thank you, Felicia. Enjoyed it. Dr. Debra Dupree, The Mindset Doc.